about our next speaker. Danielle Spearman-Camblard is a clinical psychologist who was formerly with the Behavioral Wellness Clinic in Connecticut. She's recently relocated her practice to Virginia.
Hello and welcome. I'm Dr. Danielle Spearman-Camblard, and today I'll be presenting about racial stress and trauma. Here's a little bit about me. I am a media contributor. You may have seen my interviews in the popular press. I'm the founder and clinical director of Family Focused Counseling Services, psychologist with the Behavioral Wellness Clinic. I'm a licensed clinical psychologist in Connecticut and Virginia, and a telehealth licensed psychologist in Florida. I'm also a credentialed National Register Health Service psychologist, and I received much of my clinical training and expertise through Yale University School of Medicine. My expertise is in race-based stress and racial trauma, CBT, PMADS, and infant, children, and adolescent mental health. And like I said before, I've definitely been featured in the popular press. You may have seen some of my media interviews in Reuters, US News and World Report, and Business Insider. So now moving on to our learning goals for today's presentation. I'll be describing the various causes of racial trauma. We're going to talk about the clinical implications of racial experiences leading to trauma symptomatology. I'm going to communicate how historical, cultural, and individual trauma compound traumatization, and also identifying tools for assessing stress and trauma symptoms from experiences of discrimination. What is racism? Well, there are different examples, such as the old-fashioned racism that we learn about in school involving slavery, modern racism that is systemic in nature. Racism can be described as aversive, and racism can manifest in the form of microaggressions and structural racism, in which we see an imbalance of power where ethnic minorities are at a disadvantage. Now I want to talk a little bit about the different components of racism in the system and how it's systemic. So structural racism is really about the development of policies, procedures, laws, and practices to benefit and maintain white people in power. An example of that can be legacy programs that grant preferential college admissions to children of alumni. Then there's institutional racism, and that's differential access to goods, services, and opportunities based on perceived racial identity. An example is the overrepresentation of BIPOC youth in under-resourced schools. Then there's environmental racism, which is a disproportionate placement of hazardous material near BIPOC communities while protecting white communities. So an example is the rerouting of the Dakota Access Pipeline through the Standing Rock Indian Reservation. Another example of environmental racism is what happened in Flint, Michigan, and the polluted water supply in the Black communities, and how these types of problems weren't resolved immediately. And there really is a divided perspective about the experience of race. So Soon and colleagues in 2007 conducted research and found that white people in our society tend to believe that racialized groups are doing well in life, that racism is no longer an issue, they are not capable of racist acts. White people tend to limit their definition of racism to blatant, intentional, or overt acts. But few people who commit racist acts will admit to intentionally wanting to harm others due to race. So under this definition, very few acts of racism would be defined as such. Even good people, quote unquote, enact racism. Versus people in racialized groups, on the other hand, are confronted with daily acts of racism, and they have a different racial reality. So here we can see how racism is real and systemic. I won't go over all of these stats, but as you can see here, the experiences of Black Americans versus white Americans in terms of opportunities and being able to be able to afford housing, for example, like the homeownership, the first stat, 43.5% versus 72.9%. That's a huge difference. Even in terms of earned income, you can see the differences there. The unemployment rate tends to be higher among Black Americans. The infant mortality, sadly, is higher among Black Americans. and so on and so forth. We see maternal mortality being at a very high rate. Here we have the Black Omnibus Act that was enacted earlier this year, and that was because we were seeing such a high disproportionate rate of Black mothers dying under medical care in this country. So those are just a few of the statistics really showing the differences in experiences of racism. Common racial traumas typically include police harassment, search and assault, workplace discrimination, community violence, murder of loved ones, incarceration, distressing medical and/or childbirth experiences, experiencing or witnessing torture, ethnic cleansing and persecution, destruction of cultural practices, living in a war zone, immigration difficulties, and deportation. And these common racial traumas were investigated by Dr. Monica Williams and colleagues in 2018, as you see the citation here at the bottom of the slide, when assessing PTSD in ethnic and racial minorities. Here are specific examples of racial traumas that may fit criteria for PTSD. So, you know, when I think about deportation, and you know, recently in the news, you'll see the deportation category there on the bottom. I just want to start with there first because of the fact that we recently saw how thousands of Haitians were deported from a Texas camp. And you know, I think it's important to highlight here that refugees are at a higher risk of experiencing complex PTSD, which is prolonged and repeated severe trauma. And the children that witness violent confrontations and losing a family member are experiencing racial trauma vicariously through their parents, and the impact could get passed down through intergenerational transmission of trauma. So I just wanted to highlight that first because of what we've seen recently in the news and how children are being impacted. But you know, taking a step back here, the first category, an example is, you know, overt racial slurs or threats made in any environment by anyone. So, you know, a perpetrator using a negative racial or ethnic epithet to refer to the victim, or threatening the victim with assault or death. You know, police harassment, we hear all the time about police brutality. And so law enforcement officers assaulting a victim physically, issuing threats, or searching a victim's body for evidence of a crime, for example, weapons or drugs. Workplace discrimination, co-workers expressing racially motivated threats or carrying out physical assaults against the targeted individual in the workplace. Community violence, a victim witnessing a violence, being afraid for his or her life and her personal safety or that of family members. Distressing medical experiences, a victim has persistent fear for their own life or for loved ones due to medical mistreatment. Incarceration, a victim who was physically or sexually assaulted while in prison. Immigration difficulties, a victim experiencing physical or sexual assault or robbery or fearing for their own life or those of their loved ones during the immigration process. And of course, I already mentioned deportation. Racism traumatizes the whole world, as we remember George Floyd. Even small instances of discrimination could cause psychological distress when experienced with enough frequency. So here are some examples here on this slide, like being followed in stores shopping while being a Black person, being profiled by law enforcement, racial slurs, threats, cashiers asking for extra ID, insensitive remarks by coworkers or friends, or white nationalist rallies. And I think about this little cartoon depicted here on the right. You know, how many of us have gone to a sports game and have seen mascots in which the message is a clear indication of a racial microaggression? You know, and it says here, says, you know, go savages, kill them. And, you know, you have the gentleman to the left there looking very distraught about that. And he says, but I'm honoring you, dude. That's what it says. And, you know, in people's ignorance, they assume that this is okay. But it can be very hurtful to minoritized groups of people. Now I would like to talk about counselors and race-based trauma. Hemmings and Evans in 2018 investigated counseling professionals' experiences with identifying and treating race-based trauma and the relationship between training and treatment. So they used a sample size of 106 people from the population. And so what they found is that they looked at all the different types of racism described here, like intentional covert acts of racism, hate crimes, institutional racism, microaggressions, outside group racist comments, overt acts of racism, racial discrimination, racial profiling, and within group racist comments. And so the results is that they found that 70.8% reported that they had worked with clients who had experiences with race-based trauma. 66.9% had not received training to identify race-based trauma, and 81.1% had not received training to treat race-based trauma. Racial microaggressions, in terms of how we define them, they're small racist acts that are not clearly racially motivated, and they occur frequently in everyday situations, and they create uncertainty and anxiety in targets. So, the sign here, you can see the girl holding an example of a racial microaggression, and it's also a backhanded compliment as well. Microaggressions can be defined as deniable acts of racism that reinforce pathological false stereotypes. They reinforce inequitable social norms and power differentials, and they communicate exclusion. Here are the different categories of racial microaggressions, and I'm going to share examples of each. So the first is assumptions about citizenship. For example, what is your nationality to a person of color? Forcing a racial category. What is your race? Assumptions about intelligence, competence, or status. For example, how did you get so good at science to an African American? False color blindness. An example of that is, I don't think of you as Hispanic. Criminality or dangerousness. For example, be careful, that guy looks like a thug to me, or campus police harassing students of color. Denial of individual bias. I would never treat a minority person differently. Myth of meritocracy. Everyone has an equal chance at success is a common example of meritocracy. Reverse racism hostility. Discrimination against whites is bad too. Pathologizing presumed cultural differences. For example, why are Black people so loud? Or Black fathers are just not around. Second-class citizen, ignored and invisible. A waitress forgetting to take an order of a customer of color. Tokenism, including a person of color to promote illusion of inclusivity. And I want to, expound upon this one a little bit more. Some may assume that hiring one person of color makes their organization diverse, as if that one person is supposed to represent and speak for all people of color. That is an illusion. Next category, connecting via stereotypes. What's your favorite basketball team to an African American? Exoticization and eroticization. I've always had a thing for Asian girls, or can I touch your hair? Avoiding and distancing. For example, a cashier putting change on the counter set up in the person's hand, or a person who believes that they shouldn't talk about race because it's not polite. So in other words, for that last example, that's a way of avoiding the pink elephant in the room. Environmental exclusion. No people of color depicted in the workplace artwork. And then also environmental attacks. So what happened at Robert E. Lee High School in Montgomery, Alabama, there was a statue of Robert E. Lee. He was a Confederate. And the connection of Lee's name and the statue on a high school attended by predominantly Black student body was a source of frustration and race-based stress. And then the outcome was that 4 Black people took the statue down and they were arrested. Another example of a racial microaggression is when a Black woman is asked if her hair is real and can it be touched. This is a socially learned and an unspoken means of reestablishing dominance, and is racially motivated due to the history of slavery. So what is probably a harmless fascination with Black hair by non-Black people has deeply historical racist undertones. And so sheer curiosity can be damaging, especially when the curious parties haven't done the work to understand someone's lived experience. So think about the slave trade just 2 centuries ago, where Black women were put on display in museums or in traveling shows for white audiences to view. This can be stressful, anxiety-provoking, and traumatizing for Black women. Some Black women feel infantilized and powerless, like a child with no autonomy over their own body, especially when people ask with their hands outstretched, unwilling to wait for an answer. And this behavior represents centuries of oppression and humiliation for Black women. So the catch-22 for minoritized individuals is that deciding to do nothing, like sitting on one's anger, occurs frequently. And because of the fact that victims may be unsure if a microaggression has occurred or be at a loss for how to respond, they may be fearful of the consequences. They may rationalize that it won't do any good anyway. They may engage in self-deception through denial that it didn't happen. And they may be ignored or dismissed when communicating problems to superiors. Responding with anger and striking back, perhaps a normal and healthy reaction, is likely to engender negative consequences. Telling others about experiences of racism can result in negative social consequences such as rejection or blame. And yes, even well-meaning professionals like you and I commit microaggressions. Most of us go into helping professions because we care about people, and many microaggressions may seem positive at face value, but professionals may not realize how their comments have affected clients. Can experiencing microaggressions be traumatic? And the answer is yes. And I'm going to go into details about why that is. There is research showing how microaggressions cause trauma. The discriminatory incidents are traumatic. They affect survivors in ways that are analogous to the effect that rape and domestic violence have on their victims. The act is a violation of an individual's personhood. The victim feels disempowered and powerless, and the events are unpredictable and uncontrollable, and they may be challenged, ridiculed, or dismissed by others. The recurring violence of microaggressions are similar to bullying or sexual harassment, and subtle acts may be worse than overt acts, according to research. Microaggressions impact care. They can result in compromised patient care and mental health disparities. Racial categories are socially constructed, but still have real consequences for those who are racialized. This may be doubly true for those with multiple marginalized identities. Microaggressions are a major barrier to establishing a strong therapeutic alliance with patients of color, and they may not return for follow-up visits or fail to adhere to treatment recommendations. They may have prolonged suffering for a treatable condition. Now we'd like to talk about how to respond to microaggressions. Here's an example of how to invite others to call you out. So I'm going to read here the text box. I want you to feel comfortable and appreciated as we work together. Please let me know if anything I say or do makes you feel disrespected in any way. And what to do if you are called out. Well, just because you committed a racist act in ignorance doesn't automatically make you a racist. Discern the difference and appropriately process. Don't get defensive. Agree there's a problem to be solved. Show you care about their feelings. Showing empathy, I can't emphasize enough, goes a really long way. And apologize for causing the hurt. And actively listen. Ask why what you did was racist. And validate other people's perspectives. Acknowledge any of your own biases that may have played a part in any interactions you've had with people. Clarify any misinterpreted remarks or behaviors. And then make it right. And here's an example here that I want to share. It's bad enough you have to deal with comments like this at work. You shouldn't have to deal with it in therapy too. I'm not going to charge you for today's session. Now, what else can we do? Well, we can accept that microaggressions are real and harmful. We can acknowledge the mental health consequences of racism and bias in all their forms. Provide support and care to help those who are suffering. Encourage people how to identify, defend against, and stop microaggressions, and call it out when you see it happening. Allyship is also really important to really foster healing and moving forward. So allies are people who recognize the unearned privilege they receive from society's patterns of injustice and take responsibility for changing these patterns. So if you see a microaggression, be an ally. Make supportive statements. Many people are so worried about being offensive that they completely avoid talking about race, ethnicity, and culture. Supportive and positive statements about a person's culture could be an important means of helping them feel understood. Many people miss opportunities to be supportive out of fear of offending. Make microaffirmations. So this is suggested as an opposite to microaggressions. Small acts that foster inclusion, listening, comfort, and support for people who may feel isolated or invisible in a specific environment. Subtle or ambiguous kindness cues that can include tone of voice, space left between people when interacting, subtle reflections, and actions that convey vulnerability. And research has shown that positive, subtle verbal, and often nonverbal communications that typically are considered more authentic than direct or overt compliments. How can experiencing racism cause PTSD? So that's something I want to get more into. And I want to talk about how this all happens. So racist incidents are traumatic. The research has shown that time and time again. They affect survivors in ways that are analogous to the effect that rape and domestic violence have on their victims. It's an act of violation. The victim feels powerless. Same thing of what I said before about microaggressions, similar research outcomes here. Events are unpredictable and uncontrollable. They may be challenged, ridiculed, or dismissed by others. The recurring violence of microaggressions similar to bullying or sexual harassment, and the subtle acts may be worse than overt acts. So same exact thing that I've described before. And now I'd like to talk about PTSD in people of color. So the National Survey of American Life found that African Americans show a prevalence rate of 9.1% for PTSD versus 6.8% in non-Hispanic whites. The increased rates of PTSD have been found in Hispanic Americans, Native Americans, Pacific Islander Americans, and Southeast Asian refugees. The history of any previous exposure to traumatic events is associated with a greater risk of PTSD from the index trauma. And the results are consistent with the sensitization hypothesis. So that's a model that posits that individuals become sensitized to stress over time, such that the level of stress needed to trigger episode onsets becomes increasingly lower with successive episodes. Trauma is cumulative when we understand the impact of racism on people, and we consider structural racism and barriers to care. We consider invalidation, a traumatic event that occurs, microaggressions, everyday racism, and cultural trauma. So with the different types of racism that people experience repeatedly, we've learned that as race-based stress increases, so does traumatization. This is a model adapted from Dr. Monica Williams and colleagues, which explains how the cumulative effects of racism can lead to PTSD. According to this model, predispositions of vulnerability, such as epigenetic risk factors from historical or cultural trauma or racial oppression, set up a stress base, which is exacerbated by cumulative experiences of overt and covert racism. If individuals are the targets of racially traumatic events, they will experience emotions associated with this event, such as shock, fear, or anger. If these experiences are invalidated, then these individuals may develop symptoms of PTSD, such as intrusive thoughts, avoidance, hypervigilance, and negative changes in mood and cognitions. Also, due to institutional racism and barriers to treatment, professional help may not be accessible, which maintains or worsens PTSD symptoms. This could take the form of lack of awareness by healthcare professionals and their discomfort with addressing issues of race, leaving racial PTSD and trauma untreated. Intergenerational transmission of trauma. People of color are born into this world inheriting racial trauma, by direct experience, which is further aggravated by the traumatic experiences of their parents and grandparents. Think about a wound as an analogy that wants to heal, but re-injury is inevitable. This is what intergenerational transmission of trauma feels like. The key difference between PTSD and racial trauma is that most people are able to heal when the trauma goes away with PTSD. However, racial trauma is continuous because racism is everywhere. So the challenge to heal intergenerationally is greater. The pandemic has brought racial trauma to the forefront as victims must face the unthinkable double dilemma of navigating the safety of their health and race. And so, I'm thinking about the double pandemic with COVID-19 and racial trauma. And so the race-based stress is an additional layer to the chaos that we're dealing with right now. So it's important to just keep all this in mind and how we understand trauma and also how it's transmitted generationally. We have a plethora of research demonstrating mental health outcomes due to racism. Adverse outcomes include PTSD, stress, anxiety, depression, substance use, alcohol abuse, binge eating, severe psychological distress, psychosis, disability, suicide, and OCD. Another example of adverse outcomes is the trauma police violence. So people may suffer extreme psychological distress when confronted by law enforcement, and this may be particularly salient for Black, Hispanic, and Native Americans due to their cultural history. Many different racial and ethnic groups have experienced racial trauma from the history of slavery in this country, experienced by Black people, the Holocaust experienced by the Jewish people, Indigenous and Native Americans, and there are many other examples. Harmful coping is something that's really been problematic because of the lack of support provided for people who experience racial trauma. And so it can include denial, substance use, aggressions, self-blame, self-harm, and suicidal ideation. A woman named Jasmine Pierre survived multiple suicide attempts, and she wanted to really create a difference and make a difference for those who were suffering from racial trauma. And so she created the Safe Place, which is a free Black-oriented mental health app that's been seeing a rise in signups during the pandemic. So that's a nice resource to be able to share with others. Now I want to explain what the transmission of trauma looks like clinically. So here's a case example of a 30-year-old Indigenous woman with a history of trauma as a child. She experiences racial trauma at the workplace when a supervisor tells her to make a rain dance for them, and another coworker makes jokes against Indigenous people. When she speaks out against the behavior, her experience is dismissed as a misperception. Prior to this experience, she was a high achiever, successful in her career. She could effortlessly give public presentations and was a confident problem solver. Her symptoms included hypervigilance, GI symptoms, tearfulness, brain fog, psychomotor retardation, lack of energy, panic attacks, an exaggerated startle response, and suicidal ideation. And the impairment in her functioning was that she was unable to work and described herself as a completely different person who struggled with self-care. She can no longer give public presentations and had difficulty with concentration and decision-making. She began to have nightmares about her childhood trauma as well. And so the intergenerational transmission of trauma in her family was presented as like being normalized. Both trauma and abuse was normalized in her family. So an example was that she would hear her parents make statements like, if you didn't go through that, you wouldn't be so good in school, or we all experienced that, and so you should expect it too. And then here's a second case example of a 20-year-old African-American man. He experiences racial trauma on a college campus when targeted and racially profiled by campus police. His symptoms included flashbacks, hypervigilance, avoidance, an exaggerated startle response, heightened reactivity, persistent negative beliefs, and anxiety. He begins to avoid all campuses, feels more on guard and irritable when a police officer is nearby. He feels that no one can be trusted and the world is against us. In regards to intergenerational transmission of trauma, he recalls the traumatic stories that his parents experienced with systemic racism and his grandparents experienced during the civil rights movement. He expects that racial discrimination is inevitable because of the recurrent situations in his family and other families of color. He carries the burden of their pain while navigating microaggressions on the job and at school, and this can lead to a heightened hypervigilance. We do have validated scales that can be used to assess racial trauma. For the sake of time, I won't go through all of these, but many of these can be found in public domain on my colleague, Dr. Monica Williams' website, which is mentalhealthdisparities.org. But I will kind of go through a couple of these that I've even used in practice when I treat clients with racial trauma. So the RBTSSS, the TSDS, can really be used to gather the experiences of clients, how they were impacted. It looks at all the different factors of PTSD. And it gives us a lot of clinical data as to where the person is at now. And then it's also really helpful to reassess a client about 4 to 6 weeks later so that you can monitor the progress. What you want to see is a reduction of PTSD symptoms over time. The Yukon Racial Ethnic Stress and Trauma Survey is a clinical interview, and it's a checklist to determine if racial trauma meets DSM-5 criteria for PTSD. There are 6 questions to assess ethno-racial identity development, and it's semi-structured to probe for racism-related experiences such as direct overt racism, racism experienced by loved ones, vicarious racism, covert racism, and microaggressions. And I've used this with clients as well. It can be very helpful for assessment. It's available in English, Spanish, and French. It's important to help clients process experiences of racism. We want to help them to talk through their experiences. We also want to respect client boundaries. Clients will have different levels of readiness for confronting racism. You want to go at their own pace, providing gentle encouragement as needed, and you want to praise them. So praise clients for taking the difficult task of retelling their story, because that's something that's very difficult to do. And you want to also encourage clients to use micro interventions to discuss experiences of racism with someone who offended them. So an example of a micro intervention is, every time I see you, you say things like that and it's hurtful. That's why I don't come by as often. We also want to promote growth and meaning making, like searching for meaning after experiencing a racial trauma. We want to reframe, we want to honor their story. Comas Diaz in 2016, and the research talked a lot about this. It's a style of relating that is culturally congruent with many people of color, and it's also an effective tool for remembering and retelling their story. It's also important to validate experiences of oppression. And this slide is very important in treating clients with racial trauma. So when a client discloses perceived discrimination and oppression, you want to avoid automatically looking for an alternative explanation. So for example, could it be that he or she meant something else? You want to validate their experiences or feelings because you weren't there. As a stigmatized person of color who was present for the event, your client is in the best position to determine if a racist event occurred. This is not the time for Socratic questioning. So I want to talk a little bit about CBT, cognitive behavioral therapy. It's a well-known evidence-based model. Many of us use it in practice, and it can be helpful as a treatment intervention, except for the component of Socratic questioning, which involves testing a logical thought to determine the rationality of a person's belief. Like I said in the previous slide, we want to validate clients' experiences. So questioning whether a patient's experience was racism is unhelpful and can be re-traumatizing. So when a patient reports racial discrimination, we should believe them. Now, how do we help people of color to cope? Well, we want to place the blame where it belongs, on the perpetrator, and secondarily, our cultural dysfunction. So a lot of times what can happen to people when they speak out about an offense, it's typical to victim blame. And so that's a part of what the fundamental attribution bias is. That's just a fancy way of saying victim blaming. We will blame the victim rather than hold perpetrators accountable. And so we want to move away from that. We want to seek social support within one's community. We want to encourage our clients to do that. So close friends, family, people who get it. You know, I can't emphasize enough the importance of community as a source of strength and comfort for clients. We want to help clients to limit exposure to cues of racism as needed while they recover. So, you know, maybe best for them to sign up for social media for a while, you know, so they're not consistently facing a lot of triggers. You know, the media, the news, how they constantly repeat the same news over and over again, that can be re-traumatizing for a lot of folks. Also utilize religious or spiritual practices for comfort, such as prayer and meditation. We also want to assess for safety and create an escape plan if needed. We want to help our clients with a self-care plan, help facilitate empowerment. Engaging in peaceful activism can be a very empowering way for clients to feel like they can make meaning from their pain, and also educate others and being patient with that process to facilitate mutual understanding. There is research about utilizing group treatment for racial trauma, and it involved multi-session group-based interventions targeting racial trauma among veterans. Treatment was implemented at 4 different VA sites, which provided a safe, validating environment to speak openly about racial trauma and triggers without fear of judgment or derision. Therapists facilitated meaningful and repeated exposure to distressing memories during treatment. So in summary, understanding that racism is psychologically harmful is like the first step. Then we want to acknowledge the mental health consequences of racism in all its forms. Then we want to assess racial trauma in people of color and implement interventions to help those who are suffering. Keep learning, do your own anti-racism work. That's critically important, and be a racial justice ally. I would like to share some resources for clinicians and educators. This book, entitled Eliminating Race-Based Mental Health Disparities, provides evidence-based practices and recommendations. Another book is Managing Microaggressions, Addressing Everyday Racism in Therapeutic Spaces. Both of these books are written by Dr. Monica Williams. This here is an anti-racism group to discuss various race-related issues and learning to become anti-racist. All are welcome in the group, and the URL is posted below here on the slide. So I'll wait a few seconds to give people a chance to either if they want to take a screenshot of that or write it down. Okay. And now here is some recommended reading that you may find very helpful. And you can download many of these. You see here the citation at the bottom of the slide at www.monicawilliams.com. Here are some of my media interviews in the popular press about racial trauma, which you may find helpful. And you can find them on my website at drdaniellespearman.com. And I'll wait a few seconds here too to give you a chance if you want to write down the website or take a screenshot. Thank you for taking the time to listen and join me today. Here's my contact information and where you can find me on social media.
Thank you so much, Dr. Spearman. That was fantastic. So much great information.
Oh, you're welcome. It was my pleasure.
Yes. And I guess we have Rico here as well. You're muted, Rico. I think you can unmute. Yes.
Got it. Good morning. Good morning.
Good. It's great to have you both. So my understanding is let's see, I have one question here so far. So I guess we're waiting for more questions to come in from the audience. And while we're doing that, Rico, I don't have much information about you. Do you want to just go ahead and introduce yourself?
Yes, I am Rico Hopewell. I am from Knoxville, Tennessee. I am currently a licensed alcohol and drug abuse counselor, a substance abuse professional, and a lot of more credentials behind my name. And I am a board member for the Mental Health Association as well. And I'm here as a panelist to talk about racial stress and trauma that I've endured.
Yes, that's right. That's right. Yes. And we're so grateful to have you. Let's see. So we've got another question coming in here. Any suggestions for addressing microaggressions or racism between clients in group settings? Oh, that's a fantastic question.
Yes.
Let's start with that one. I'm sure we could probably spend the rest of the time talking about that.
That is a great question. And so some of the thoughts I have in mind is, in the beginning, when you have a therapy group, you'll kind of go around and you'll try to get suggestions from the group about what the group rules should be. And one of the group rules that we typically will facilitate in these sessions is safety, and whatever is talked about in the group stays in the group, and we want everybody to feel safe and comfortable. And so that should be like the foundation in the beginning, facilitated by the therapist. But when something like this occurs, where let's just say a client says something that's offensive, it would be important to address that right there in the actual group session and provide some psychoeducation. A lot of times what happens is that people are not aware that what they said is racist. And a lot of these are learned behaviors. And so we want to just, name the pink elephant in the room and provide some psychoeducation about the microaggression and why it's a microaggression. And then the other client who may feel offended, to give them the floor to express why it was offensive to them, so that it's really a learning experience, an opportunity for everyone in the group to learn something. And that in and of itself can actually be pretty therapeutic. Hope that answers your question.
That's great. Rico, do you have anything to add to that?
Well, no, she answered it very well. And I just wanted to add, just to be able and to make sure that the clinician understands microaggressions as well, because I have been in situations where I have been the minority in a group, and I picked up on the microaggressions, and the therapist didn't. And so when I went to the therapist and said, "Hey, this was a little racial comment," I said, "Well, I didn't see it that way." So you have to be sure that the clinicians are aware too. And another thing too is that when a microaggression does happen, from my experience as being one of the only people of color working in a treatment center or in that field, it's sometimes uncomfortable for the facilitator or the director to go ask me, "Rico, can you go talk to them about that?" So, just to be mindful of that process too, and just to be educated on what microaggressions truly are.
That's a good observation, right? Someone did ask, one of their observations is the lack of people of color who even make appointments for treatment, especially in rural communities. And do either of you have recommendations for how to reach out to those communities? Again, I was in graduate school in the early 90s, and this has been an issue for decades, obviously.
Yes, I think it's really important to really harness the wisdom of the community. And so, people of color, they're the experts on how they're impacted by any form of racism. And so a lot of people of color won't access mental health therapy because of their negative experiences with being discriminated against. And when they express some of the justifiable anger that they feel, a lot of times they are ostracized or even misdiagnosed. I have a racial trauma client who made one statement during an assessment with a clinical social worker, and the police ended up being called and showed up at her house afterwards. And so a simple statement was turned into a misinterpretation of a homicidal ideation, sadly. So she's traumatized through that and didn't even want to access therapy anymore because of that. And so it's really important to harness the experiences of the community and validate, and even having, a meeting in the community, just a free event where people can come, share their experiences and ask them, because they're the experts to their own pain and even to their own comfort levels. Well, what can we do to really support you and to help you to feel comfortable in therapy? I just think that people have to be given more of a voice and be empowered. And also, I want to say that, it's really important for therapists, this is why I love doing these presentations, to really be prepared to know how to handle these topics. So that way, when we're communicating in the public, it shows that we're aware and insightful, which would really help to build bridges.
Great. Rico, anything to add to that?
No.
I think a presentation I heard earlier this year also, a group I was involved with, someone recommended reaching out to the religious community, because many African Americans anyway are very strongly embedded or engrossed in their religious communities, and they tend to trust maybe their religious leaders more than now. Maybe I'm making assumptions about that aren't valid, but that was what one of their leaders was saying.
I've spoken to my pastor about that same issue, and a lot of times people of color do feel more comfortable with going to the church and talking to the church pastor. However, it has to be understood that a lot of times the church pastors or the elders or other members are not qualified to address some of the issues that need to be addressed. So I think it's really important that if an organization does go to the church, there has to be a solution to not just bringing the problem to the church, but what is the solution? What is the action plan to be able to help the community? Because a lot, and that can go back, and this can go back all the way to, we go back to the slavery days, and it was like this whole issue with, we're not getting what we need, so we're going to ask the pastors of the church to help the Black folk. And so that goes all the way back. Instead of educating yourself on about, okay, how do I really truly help this population? How can I really truly help them and be more effective in counseling? Because I am a counselor now, and 99% of my clients are white males.
Wow.
So I have to educate myself too as well about their process. So it's all about education for me right now.
Right. And I think that's a really excellent point, Rico, which is why I also serve as a consultant for churches, because a lot of pastors will definitely help with the spiritual component of things, but it's the being qualified as a mental health professional is a whole different ball game. And so I like to partner with a lot of other organizations and churches to be able to provide the psychoeducation about mental health disorders and how we could be supportive and really be able to build those bridges there too.
Great. So I was reminded you have some slides to share about case studies and a 5-minute video call to action. Is that something?
I do have some practice questions to engage the audience. Can everyone see that?
I think that's good.
Okay. So, earlier in my presentation, I talked a lot about different types of microaggressions, and I also, talked about the different categories of racist acts. And so it's just kind of an opportunity to kind of connect all the dots together, give you some actual examples. And I want to see what everyone thinks. The next slides I'm going to show, some are microaggressions, some are microaffirmations, and some are neutral. Which are which and why? And so we're just going to kind of go through some scenarios here, and I want to see what you guys think. You can add your comments to the chat.
Great.
Here's the first one. So you have a new client who is a 20-something-year-old African-American female wearing a traditional, colorful African-style dress and has long hair with scores of tiny braids and golden beads woven into them. Her hair is rolled into a large twisted wrap. So some of the responses she hears is, one, I've always wanted to go to Africa. The next one is, your hair looks amazing. Why do Black women wear their hair in these sorts of styles? I love the colors you're wearing. Can I touch your hair? What brings you in today? You speak English really well. What are your thoughts about 1 through 7? I'll just wait, a few minutes to give people a chance to think about it. So you're letting us know which is a microaggression, which is a microaffirmation, and what you think is neutral.
So we've got someone saying 4 and 6 are the ones they would consider. The rest are off the grid. 1, 3, 5, or do you want to do this part of it, Danielle?
I can't even see the chat. I think it's because I had to share my screen. Let me see if
okay.
I can make the window bigger.
Okay.
I might be able to see it. Hold on, let me just.
Yeah, I had to change my view to be able to see the chats.
Right.
But they're coming in kind of weird.
Okay. Let's see. For some reason, I still can't. Yeah, for some reason, I don't know why. Oh no, maybe, let me just try something for a minute. Bear with me. I'm going to try something different. All right. Here we go. Now I can see them.
Great.
So let's see. Oh yeah, a lot of people are responding here.
Looks like we have some good consensus.
Yeah, we got some good answers here. Okay,
yeah,
so I'm going to share my thoughts.
Okay.
about this. So the first one is a microaggression because of the category that I talked about earlier, the assumption about citizenship. Okay, so the first one is a microaggression. The second one is neutral. The third one can be an example of a microaffirmation if the person is asking with the right tone of voice and a desire to learn. The fourth is neutral. Number 5 is a microaggression that fits the category of exoticization and eroticization that I talked about in the presentation. Number 6 is neutral. Number 7 is a microaggression that fits the category of assumptions about intelligence, competence, or status. So that's that. Anybody have any questions about that?
That's a good exercise. Interesting exercise.
Yes. And I don't have the chat up anymore. Did you see any questions?
I don't
move to the next one?
see questions coming in about that.
Okay, so I'll move to the next one. Moving on.
Yeah.
Here's the next scenario. You are co-leading a diversity training. The other leader starts to discuss race and explains that white people have an unfair advantage in most every area of American life due to white privilege. A group discussion begins. Which statements are supportive for people of color and which are microaggressions? So the first one, too many white people have a hard time talking about race, and that's a problem. Everyone suffers, not just Black people. Race doesn't matter. There's only one race, the human race. It's not fair, but I've gotten lots of advantages from being white. Black people should work harder to fit into our society. Let me know what you think in the comments. Okay, let's see what we have here. Yep, starting to see them roll in.
Yeah.
Mm-hmm. Yep, you're onto it, guys. Coming in quickly with these responses.
Yep. They were paying attention.
They were paying attention, yes. Mm-hmm. Yeah, okay. Any others, or should I give the answers? Okay, I think I'll start giving the answers.
Probably
We have a
good.
good amount. We have a good amount of people that responded.
That's right.
So the first one is in support of people of color. The second one is a microaggression and fits the category of reverse racism hostility. Number 3 is not in support of people of color. It is an example of false color blindness. Number 4 is also not in support, and it's actually an example of avoidance and distancing. And number 5 is also not in support and is an example of myth of meritocracy. So that's that one. Now let's move on to the next scenario. Or actually, does anybody have any questions about that? That's what I should ask first. I don't see anything in the chat, so I think it's safe to assume. Oh, somebody's asking, I'm wondering about, I don't see the full, I'm wondering about how to
Maybe
address.
how to address if someone says those
right
things.
there. Not sure if that person can.
Yeah, maybe how to address it if someone. Oh.
Okay, so I think it says, I'm wondering about how to address, is that poor whites appear to resonate with 2 to 3. What is it? Seem to parrot these statements. Let me see. I'm not sure if I understand the question, but hold on. Let me go back. So number 2 and 3. So they're commenting about how poor whites appear to resonate. Okay. Yes. Okay. I think I understood what they're trying to say. I think they're relativizing statements. Okay. Yes. Okay. So are you asking a question, or are you just trying to share a comment that you feel that there's some white people who will resonate more with 2 and 3? Is that what the comment is about? Oh, how do you address it towards white clients? So that's a very good question. What's important is psychoeducation. That I always start there with any white clients. And so what I educate people to do is to work on their own anti-racism. That's what we call it as racial trauma experts. So a lot of times people have inherited learned beliefs from their parents. And so it goes back to Albert Bandura, the psychologist in social learning theory. Our parents are models as to, how we live, what we believe, our opinions, our attitudes about things in life. And so I like to, start off with where people get their belief system from. A lot of times I'll talk about, well, this is how my parents talk, growing up, this is what I had around me, and then provide education about why that's not okay. And just really being able to answer any questions they may have about why that is. And so when people are used to being in a position of privilege, it can be difficult to have this insight. It can be hard to be able to see why racism is wrong and how it impacts other people. But when you mentioned about poor white clients, it just sounds like it's lack of education. It's ignorance. The education just needs to be taught in a therapy session about the history, how the history has played a role, the current institutional racism that we have today, and also learned beliefs that they have inherited from their family of origin. I hope that answers your question.
Rico, you see a lot of white clients, maybe you might have some insight into that. Oh, you're muted. Oh, there you go.
I would just agree with her because I have, it's all about education, educating the people on racism and microaggressions. And a lot of times, that number 2, it's very, very prevalent. It's said a lot. Everyone suffers, not just Black people. And so when you ask the person, like, why do you believe that? Why do you think that? I think you'll get a better understanding of their thought process, and you'll be able to understand like why they believe that and why they believe that everyone suffers. So no, I don't have anything really to add to what she said.
Yeah, good. There's a question if you asking whether you have an example of a neutral response for this situation.
A neutral response in regards to the question that was in the chat, or you're talking about the situation in terms of what I have up on the
I think
screen?
the one
What I
that's
have
up on the screen,
right?
right?
Okay.
Yeah.
So looking at this scenario, a neutral response would look something like, you know, let me think of another creative one. Just give me a moment for that one. I would say you're naming the pink elephant in the room as a person who you know, wants to be able to show that you've educated yourself, that you've done your own anti-racism work. You want to name the pink elephant in the room and also show a level of support. So when I think about neutrality, I think about balance. A person who is balanced can give a neutral response to something. So they could say something like, yes, this happens a lot, you know, in white America. And, you know, I've seen this happen, you know, with a lot of people that I've interacted with, or, you know, here's some of my experiences, you know, confronting this X, Y, Z. And that's not, you know, my answer is not like an exhaustive answer where I'll give you every single example of what that can look like, but just as a general response, it can, anything that's neutral is a balanced response.
That makes
Hope
sense.
that answers that.
Great, great.
Are we ready for the next situation, or any other questions?
I didn't see any further questions. Oh, let's see. Oh, interesting. Someone commented, poor and white. Billy can say, when I grow up, I'm not going to be poor. I'm going to make money. But another Black person knows he can't change the color of his skin and the way he experiences life because of the color of his skin. A white person can change, maybe has an easier time changing their life, but we can't change the color of our skin.
Right.
Interesting comment.
Yeah, good point. Yes. When, you know, people, when we're born, we can't choose, you know,
Right.
and so, you know, people who are from minoritized groups, people of color, we are facing so much stress and burden and, you know, discrimination just because of how we look. I mean, there's examples of even just trying to go to the bank for a mortgage, you know, just even that process. I've heard, you know, situations in the news where, you know, someone wanted to get an appraisal on their home. And what they found out was that the pictures they had up on their walls of their family showed that they were a Black family, and the appraisal was lower. And then somebody had a conversation, this was a Black family, somebody had a conversation with them and said, take the pictures down and see what happens, just to test the situation. Their next door neighbor was white. And they said, hey, can you do me a favor? Do you mind? I know this is a weird question, but can I borrow some of your family photos and put it up on my wall? And the neighbor was like, okay, you know, they were close enough where they didn't mind doing that. They put the neighbor's family pictures on their wall. And all of a sudden, the value of the home was just so sky high all of a sudden. And this Black woman, it was painful for her, because she said she's so used to teaching her own two little girls, you know, the importance of, you know, being proud of who you are and embracing your ethnic identity and your race. And she said one of her young daughters asked her, Mommy, why are you taking down our family pictures? And it like broke her heart. It really did.
Yeah.
And so, and I forgot which news media outlet, a popular one that I when I was reading this woman's story, she had given an interview. But ultimately what ended up happening was, you know, that particular company was pretty much caught out. She didn't disclose the name in the actual interview, but the article was talking about how there could be a pending lawsuit coming in the future because of the mistreatment. So it's just, you know, racism is everywhere.
It shouldn't happen. Right.
Right.
There shouldn't need to be a lawsuit. Yeah.
Right.
Oh, goodness.
So next scenario. Let's see. Oh, looks like it's. There it goes. Okay. You are leading a group therapy session, and participants start talking about current events, including police brutality, affirmative action, unemployment, and education. So tell me what you think about these 7 comments. I don't think of Black people as Black. I'm upset about the unfair treatment minorities get. Racism is a major problem in our country. Everyone can succeed in a society if they work hard enough. Stay quiet so you don't offend anyone. White supremacy needs to be addressed for our country to move forward. There is so much going on in the world right now. So let me know which ones you think are a microaggression for this particular scenario.
Hmm.
Yep. You guys are on it. Mm-hmm. Any others? Here's another one. Okay. Yeah. Mm-hmm. Yeah. Yep. That next comment also correct. Yeah. You guys have not missed a beat.
So proud.
All right. Yes. So I can go over the answers here. So the first one definitely is a microaggression, and it fits into the false color blindness category. Number 2 is in support of people of color. So is number 3. 4 is a microaggression and is an example of myth of meritocracy. 5 is an example of avoidance and distancing. 6 is in support of people of color. And 7 could be an example of avoidance and distancing, depending on the motive of the person saying it. So number 7 could potentially be perceived as just a neutral statement. They're just saying, hey, there's so much going on in the world right now. That could be just a neutral statement, or depending on the motive of the person, it could also be an example of avoidance and distancing, because if during this, therapy session, people are, talking about, the different examples, police brutality, affirmative action, unemployment, et cetera, and then, a person who may not really want to talk about it could also make a statement like that. So it can go either way for number 7. Number 7 is a little tricky. All right, so those are the 4 practice questions. Does anyone have any additional comments or questions about any of those? I think I see something in comments. I read number 2 as someone saying minorities are treated better than white people, which I've heard a lot. Let's see.
Oh, you do hear that sometimes.
Mm-hmm. Interesting. So minorities are treated better than white people. So the number 2 says, I'm upset about the unfair treatment minorities get. Yeah. And again, when there's a message out there that minorities are treated better than white people, where is that really coming from? When it all comes down to it, because the reality is, are they being treated better than white people? But there are some people that do, like I agree with the comment, there's some people out there that do actually think that. So anytime any attention is given to people of color, if they want to address the pink elephant in the room, it's considered almost toxic for the topic to be discussed. And that's a part of what re-traumatizes a lot of people. So good comment. Thank you for sharing that.
One's being gets perpetually punctured and assaulted. It's the culmination of a massive onslaught of dignity assaults, both micro and macro. It's an overexposure to humiliation and dehumanization. It's what one gets as a living when we watch one of our extended selves lying in the middle of a cold street and a pool of warm blood turned cold like roadkill. It's dehumanizing, it's humiliating, it's an affront to one's sense of dignity. It is when one's definition of self is defined by someone else. It's when one sense of self is defined by what I am not rather than what I am. And so the therapist in me who sits with Black families, I'm always struck by the fact that white parents talk in very glowing terms about what their children are and what their stellar accomplishments are. And Black families feel compelled to talk about what our children are not. My son is not a bad kid. He's not in gangs. My son doesn't wear those baggy pants. This need to sort of address the ways in which our children are perpetually defined. So this assaulted sense of self is painful, enduring. It can be managed, but I'm not so sure it could be healed. I mean, if you were to imagine that for some odd reason, odd and very inexplicable reason, that each of us today came in here with a hammer and a nail, and we felt compelled to hammer the nail in the wall around here. And then it was pointed out to us how much damage was done to the wall by all these nails. And then we quickly regrouped and we went back and removed the nails from the wall. What remains are all the holes from the nails. That's what the assaulted sense of self was like for Black people. There's a way in which it is buttressed by a lifelong exposure to devaluation, which is what happens when one is stripped of one's dignity, where respect is denied. There's also this untold story around voicelessness and the ways in which in our life that the voices of people of color are often silenced. I find with people of color that it's hard for us in settings like this to even say white, to name whiteness. We resort to code language like other people, some people, members of the dominant group, that we don't name it. And I understand why we don't name it, because we have a protracted history of really awful things happening when white people get uncomfortable. And so people of color won't name whiteness, and it is rare that white people name whiteness. And so we live in two worlds. We live in worlds where we're all racially socialized, and yet it's all different, because in this world of racial socialization, we're all racially socialized. The people of color know they're racially socialized, and white people don't. And so I often ask when I do workshops, ask people of color, at what age did you begin to think about yourself racially? And it's usually around 3 or 4. And when I ask white people that question, it could be my 20s, my 30s, graduate school, my first trip to Africa. And so I'm not suggesting that's problematic, but what it does, it speaks to a divide between us, because if on the one hand, if I've been thinking about it since I was 3, and you start thinking about it at 33, it now adds perspective to why you question me about why do I always bring up race. It makes the question much more understandable when you point out that I'm obsessed with race, because I've had to live with it in a way that you haven't. And so there was a time in my life where I was always teetering on the precipice of massive reactivity. One white person said to me, "Why do you always have to speak about race? Why do you always have to bring up race? Why? I never had a good response. But now I do. I bring it up because you don't. And I solemnly swear to you, I'll bring it up less if you solemnly swear to bring it up more.
Deeply moving and powerful video by Dr. Ken Hardy. So he's a therapist and a public speaker, and just does a beautiful job expressing the pain and what needs to be done to move forward, to be able to move forward together. And so what he did was, this was like a call to action. I actually put a little description in the chat. I'm not sure if everyone had a chance to see it while the video was playing. But the question was, how much has the therapy profession confronted race in America? And at what point do we as therapists need to join the conversation, and how might we do so? And so this is just a powerful call to action for therapists to address race in and outside of our therapy offices. I just wanted to kind of see what others' thoughts were about this video, and what we can do together to be able to really just take this topic outside of the symposium. How can we take this topic to the next level? Does anyone have any thoughts or suggestions, or just even comments about the video? I do see one comment here. Someone put, "Wow, that was great." He does a beautiful job, like I was saying before, expressing this topic. It can almost leave you speechless. When you hear something
It looks like
that.
maybe it has. It definitely did me. It was very moving. Where was that?
This was at the this says here Networker Symposium address.
Right.
I could probably give a little bit more. It says here, let's see, the psychotherapy networker. It mentions how he's the director of the Eichenberg Institute for Relationships, and he's a professor of marriage and family therapy at Drexel University.
Yeah, it was nice. One of your slides, you were talking about taking action, people who do have white privilege, taking action to restore that balance. And this is exactly what he's talking about. And I guess sort of what you're asking us to discuss now is, what can we do? And not just white people, but all of us, right?
Mm-hmm.
What can we do? So now we're getting people are getting over their speechlessness.
And I think Rico might have been trying to give a comment, but I can't hear him. I think his audio might be.
Real.
There it goes.
There you go.
Yeah, his comment was, and at the very end, it said, "I'll bring it up less if you bring it up more."
Mm-hmm.
And that was just very powerful, because I've been that person that's worked in this field in our community, and I'm one of very few Black clinicians within my field, and rarely does someone ever ask me, "Well, Rico, how are you doing?" And it's still because they have, they can see themselves a lot more. And rarely does someone ask me, "Well, Rico, how are you doing? How are you navigating this system?" And just even for him to be up there speaking in front of that group was just very powerful for me, because I have been in those trainings where, I've been the only Black in a training of 30, 40 people. And there's a diversity training, and all the presenters are all white males. And so it's just, and when you bring that up, It's like, oh, Rico, you shouldn't bring that up. Oh, yes, I should, you know, because it's really not teaching diversity when you have a panel of all white males or all white females. And so for me, being in this field, I have a hard time navigating or getting support from my peers because A, I think they don't know how to support me, and B, sometimes they just don't know at the same thing what to do to support me. And I will go back to this the whole picture thing. It just resonated with me when you talk about the picture. I don't invite people over my house a lot. I live in a predominantly white neighborhood, really nice home, and I have most of my friends are white. And I remember inviting one of my friends over to my house, and he said, Rico, why do you have so much Black art on your wall? I'm Black. You know, it's like, what kind of art do you have on my wall? You know, and it was like, it's like, and he, you know, but, and so there was another conversation with the same person, said, you have a lot of Black authors. And I asked him, well, how many Black authors do you have on your bookshelf? And that even goes back to treatment or counseling. How much information do we give our clients if we want to really change the process? How much information do we give from authors or writers that are Black? Like, do we really do that? Do we really give packets and assignments out that are from Black doctors or Black authors? Like, do we really do that? And that's how we can change it too, as well. So this has been a very powerful, for me, a very, very powerful moment.
Thank you for sharing that, Rico. Oh, I'm sorry, Jenny.
Well, I've been fortunate enough to be in some really great diversity training groups, training sessions. And my takeaway has almost always been, just don't be afraid to make mistakes. I loved your slide about noticing the difference between saying something racist and being a racist. You know, we've had a couple of comments of one person saying, you know, I don't mind being out there, but I'm going to be uncomfortable or something. That's okay. Be uncomfortable. Get out there. Be uncomfortable. Take a risk. And I spent my junior year abroad in Scotland, and I just remember at first being there and being so aware of being American and thinking, this is what Black people feel like all the time, you know. And it was eye-opening for me, because I was the odd person out over there, and coming back here and thinking, you know, it's okay to get out there, try something new, say something dumb, say something about, you know, Black people go to church more than they go to therapy. And maybe that's an assumption that I made on my part that was wrong. And, you know, maybe it was, maybe it wasn't, but I might have made a mistake, but I'm here moderating this thing as a white woman, you know, but I'm out here doing something, you know, and it's okay. It's okay. I'm not a racist, but sometimes I do racist things, but, you know, it's not on purpose. And, you know, we're all trying to make the world a better place. So
I just want to piggyback, you know, because I know we're getting ready to run out of time. I just want to briefly say, because I did see a couple of comments here that I think are great comments. New growth mindset, super important. And so we are going to feel uncomfortable. That's the goal of new growth mindset, is to stretch us outside of our comfort zone and learn from interactions. And when any of us say anything inappropriate, you know, it's okay for people to like privately call us out on it and educate us as to why. And that's what helps us to grow. So that should be like the focus going, you know, moving forward and working with our clients, and invite your clients to call you out on stuff. You know, if you're not sure about something, or if you didn't know and just something just completely went over your head. Someone said here that, you know, one person of color shouldn't be responsible for the trainings at a company. I agree with that. I give presentations all the time about this topic within corporate America or organizations about that's the example of tokenism too. The microaggression I talked about during the presentation is that it's not our job to educate all the other staff. It is the leadership, it's their role to educate themselves and bring in people who have the expertise to be able to give seminars and webinars, but to ask another coworker who is Black or whatever race to be the holder of information to train everybody, they already have their other, position that they work 9 to 5, and now you want them to do this other role over here. It's a burden. It's too heavy. And so, it's just important. It's important for us to consider these things.
Okay, well, let's end on that. This has been fantastic. Thank you so much, both
You're
of you,
very
Dr.
welcome.
Spearman and Dr. Hopewell. We appreciate you greatly. And I guess it's lunchtime. Don't forget to fill out the feedback. There's a tab on the main website to get your continuing education credits. We'll do this again sometime. Thank you so much. Take care, everyone.
Thank you. Bye-bye.
Bye-bye.